I wanted to talk a little bit about some existing data resources that are available that may, in some cases, either help with grant preparation that leads to a prospective trial where you're enrolling subjects, or can result in some meaningful research where you don't enroll subjects at all, but instead use data resources that are lying around. So I'm going to talk about 4, and I'm going to do it quickly, I promise. The first is that I lead the clinical reporting unit in the Department of Biomedical and Health Informatics, and we spend a lot of time building custom data sets derived from data at CHOP, and in the near future will also allow us to work with data derived from Penn, although we have, that's been done on a couple of occasions, but we're looking to expand our capacity to combine CHOP and Penn data so you can actually look at outcomes that occur in adulthood, for example, as well as obtain NICU data for some of our sickest patients who were born in a birthing suite at Penn. I'm also going to talk about a collection of primary care data that was put together by the American Academy of Pediatrics that is hosted here, also known as the CER squared data set. I'm going to talk about PedsNet, which was a PCORI-funded data initiative, and then a few words about a pediatric emergency department data set that's organized by the PCARN group. First of all, the group that I lead, Clinical Reporting Unit, we work in collaboration with researchers who need electronic health record data, and I'm here today just to make sure that people are aware that this resource exists. The electronic health record data is quite complicated, and we view ourselves to some extent as data concierges to help people to make sense of the complexity of electronic health record data for their project. In particular, we assist researchers with validating the data. Data that are collected as part of routine care have systematic errors in them sometimes that can result in faulty research conclusions. So we spend a lot of our time trying to avoid those pitfalls. Generally, our efforts are funded as collaborators on grants. However, we do work with quite a number of fellows or junior faculty or people who are involved just in grant preparation activity and do not have funding. And in those cases, just as I mentioned for PERC, there are other resources that can help to pay for our efforts with supporting those projects. Going forward, we're working with natural language processing so we can take advantage of some of the information that's buried in physician progress notes. And we can deliver data in a variety of different ways. Most commonly, we're using REDCap. This is especially helpful if somebody's doing sort of a combined project that uses some existing data as well as doing some primary data collection, where you can get much of the data filled out in REDCap ahead of time from the electronic health records, and then additional data can be collected through telephone interviews or other study procedures. The American Academy of Pediatrics has a primary care data set, which we care for here at CHOP. It is governed by the Academy of Pediatrics, and the doors, however, are wide open for research at this point. The network is actively seeking collaborators who are looking to do secondary analyses of the data that we have. We currently have primary care data for 1.2 million children. We have over 200 practices that have submitted data electronically, spanning 27 states and over 2,000 providers. And we've done a number of research projects looking at, for example, growth outcomes related to psychotropic pharmacology. We're looking at the ways that pediatricians do and do not treat hypertension and asthma management, and there are numerous other projects that can be done. And this could be a good source of data for very easy to get access to, since it's right here at CHOP. PedsNet, as I mentioned, is funded by PCORI, and they have an even larger data set, 4.6 million children. This group, rather than AAP, which is working with small primary care practices, is working with a few large healthcare systems They have, in addition to primary care data, they have specialty care data, emergency medicine data, as well as inpatient data from the 8 locations shown here, spanning a large portion of the nation as well. They've also worked to develop some self-service tools for looking at the data, which I just have a couple of screenshots here. They're using an interactive tool that allows researchers to sort of slice and dice the data on their own to look at variability in particular measures or outcomes, looking at the size of different cohorts, and potentially looking at variables over time. Both of the AAP primary care data set, as well as the PEDS-NET, sort of hospital health system-based data, have many, many years of observation data on patients. The last one I just want to highlight is the Pediatric Emergency Care Applied Research Network, which has a sort of a sub-study called the Registry Project, which involves the 4 sites that are circled in red on the screen. And we have 3 years of emergency medicine data that has been collected. And this actually includes de-identified narrative data and a lot of other rich data sources. So for researchers who are looking at emergency care, this is a really valuable resource, and is also actively looking for potential collaborators to help utilize the data that have been collected.